Hello everyone, good morning and welcome to today's session. So as in the previous session we learned about gelsemium. In today's session we will learn about another beautiful remedy which was one of the earliest discovered remedies of Dr.M.L.Sehgal, and it's one of the principal remedies which are used in our method, that is Sehgal method. It is most commonly observed and practiced and prescribed remedy in our method, and it's a very beautiful remedy. It's Belladonna. You all must have used or heard about this remedy and read about it. Today we will learn about how we prescribe it in our method, like by the understanding of rubrics like light desire, frivolous, indifference alternating with sensitiveness, mood repulsive, high desire. So with the help how to identify a belladonna patient when it comes to your clinic. So let's start this beautiful journey by welcoming Dr.Yogesh Sehgal to start it.
Hello friends, Namaste, Salam, and I hope that you have already on this road of rediscovery of homeopathy and perhaps have got idea that how you could use it in the practice. So in the today's session, I'm going to start that, the first idea comes for those who are learning now, like this Iran group, that whatever I have been telling you about using the rubrics and the explanation I have been giving you is based on the proving or is not based on the proving. If the prover has used the rubrics like this, or the information which I have been giving to you coming from the prover, or like from Dr. Honeyman and further on, the doctors. So what I would say that whatever clinical utility of rubrics and clinical suggestion of medicine, which I have been telling you or my father had done, so far I cannot say, that it is based on the proving, but it is based on our own clinical information. You know that everything in our life, it happens by chance. You will agree with this, that it's like sometime you try to open something and by chance it gets open, and then you get the idea that, oh, there is another way to move, walk, or do the things. And so there are many things which are coming in life by chance. And this is the same thing which happened with Dr. Sehgal when he, first thing when he saw the rubrics in the repertory, especially the mind section, he wasn't sure what to do with them, but he was amazed by the writing in the like a rubric. So there was no one to guide him how to use it that time. There were no books available. There was no clinical data about the repertory, but there were materia medica available, lots of materia medica, but there was no books to explain the rubrics. So it was because of his, you can say, admirer of the Kent repertory. He started to use or look into the rubric, how to, then he had to follow the dictionary for meaning of every word, and later on he started to use example one by one, and it got hit. It's like a discovery by chance, but he started to get result from that, and on the basis of the result he started to move further. So friend, that homeopathy is not only many-sided but all-sided. It means that homeopathy has a variety. If I think you must be aware that the first follower of Dr. Honeyman was John Stuff. He was the first pupil of Honeyman and who supported. But then came, that Hoeninghausen, who was not a doctor, who was a lawyer, who was a botanist. And when he got sick, by chance, when he got sick and he thought that he's going to die with tuberculosis, and he was recommended by Pulsatilla. It was a by chance. Somebody suggested, take Pulsatilla, and he got cured. His tuberculosis got cured by Pulsatilla, and he never knew what is Pulsatilla. And then he became a staunch follower of homeopathy. And Honeyman, he was a favorite student of Honeyman. So things have appeared, it's a by chance things start to happen. And now today, when I'm giving you the information from my cases, from the rubrics, honestly, all the rubrics which I tell you about the remedies, we have applied, and I have applied. Basically, I have applied from last 32 years. I have been applying, still I have been applying with success. So the idea of passing the information is that I'm responsible for the well-being of human. So in no way I would like that my information should harm any human. That is, you have to keep in mind. But how far you can use it, it is up to you. How much you learn, there could be many doubts, there could be many difficulties to use this. Now, the one thing which is clear to my mind, that there are three grades of problem: genetic problem, heredity problem, autoimmune disorders. Now, for a human being to understand these three kind of things: genetic disorder, heredity disorder, and autoimmune disorder. So you see that the population today, the population in the entire world, they are having in mind that their problem is genetic, so nothing can happen. Their problem is autoimmune disorder, nothing can happen. So their problem is inherited by family, nothing can happen. So on the one side, when a patient goes to a doctor with certain kind of problem, arthritis, blood pressure, diabetes, certain issues, he was told, the patient gets the doctor, the medical science tell that, oh, it's a genetic problem, it's a autoimmune disorder, or it's a heredity problem. So what the patient should do now? Nothing, only symptomatic relief. So the patient, most of the patient in the world are content. They have to be content. They have to agree with the medical science that nothing can happen in their case, and they have to live or die later on with the same disease. I hope you understand what I'm trying to say. Do you agree with me? Okay, so a patient is now roaming around in the world of medicine to get better. And now when a patient is told that your problem is genetic, he doesn't know what is genetic. When the patient is told your problem is autoimmune disorder, he doesn't know what is autoimmune disorder. He agrees whatever is told, and he start to believe nothing can be done now. Now, what happened? Somehow the patient gets the idea from a friend, from general, from any idea that there is a homeopathy in this world. Now the patient has no idea what is homeopathy and how it differs from medicine. He thinks that this is another kind of a proposition. Maybe it can deal with genetic disorder, autoimmune disorder, or inherited issues, which he has heredited from the heredity problems. And he doesn't know where is the answer for this. So in the beginning, maybe when a patient goes to a doctor with a rheumatoid arthritis, with certain problems, and then he keeps silent, taking painkillers as he knows there is no other way just to tolerate the pain. And when this patient comes to homeopath, and he tells the homeopath that a medicine doctor told me that my problem is genetic, my problem is heredity, or my problem is autoimmune disorder. Do you have a medicine for this? Now, as a homeopath, what shall I say? Yes or no? What to do now? Because if it is a genetic problem, what homeopathy can do? If it is an autoimmune disorder, what I can do? If it is a heredity problem, what I can do? So many problems in the world are under these three categories, which are according to the medicine. According to the medicine, not according to homeopathy. As a science, it's a science. Okay. Now, how can we understand that the problem is genetic? Now I'm coming to a layman. For example, a child is born. And if we believe that the genetic disorder started to happen on the day one when the sperm and ova they met, and the development started. So the genetic disorder started at that time. And the patient is growing, and now the child is born. Now there could be some visible symptom during the birth, and a doctor can diagnose, okay, there are certain problem with the child after the birth, and now it is a genetic problem, and the parents are confused what to do with the ADHD, with the autistic children. I mean, they have no idea what to do now. It is only the tag, there is a tag. The child is genetic. Now, matter is finished. And the parents are carrying the child, what to do, nothing. They have no idea what to do. And now sometime a child is born, started to grow. And at the age of 40, 50, a person develops a certain kind of disease. And when he visits a doctor, he's told that you are having a genetic problem. And he is confused now from where the genetic problem came after 40 years. For 40 years, there was nothing. After the age of 40, suddenly the genetic problem developed. Now, there is no answer that how this genetic problem has developed in a person. From where? Patient has no idea. And then the patient is told that now your problem is autoimmune disorder. He has no idea what is autoimmune disorder. So what a patient wants? A patient wants a solution. But there is no solution in medicine. There is only a problem and symptomatic relief. Nothing else. So there are list of problem, but there is no solution for the problem. So when a patient is coming to homeopathy and he asks doctor, if you cure genetic problem, now the thing is that I don't know whether it is a true genetic problem or it is named as genetic problem. We have no idea. And also we have no idea that when you come to know that you have a genetic problem, early in the childhood or later in the when you grow, you never know about this. Okay, so that is the one of the basic problem that nowadays that homeopath, they try to say that, okay, we have been trying to find the solution for the genetic problem, we are trying to heal genetic problem. Whether it's possible yet or no, I have no idea. So that is the first kind of information which we are getting from the patient. Now, what is a genetic problem? Genetic problem is like a seed of a problem, very little seed of a problem, which developed in a person due to some error or whatever. And this seed, start to grow in the later in the life. So there is a seed, you can call it a genetic seed, and later on it become a disease or a problem or a sickness. And we have no idea this seed is there in the human being since when, no idea. Now, friend, today I'm going to tell you something from my side, that there are two kinds of bad seed and good seed. This is a very vital thing you have to learn today. You know that when we develop, when we start to grow 1 year, 2-year-old, 3-year-old, 4-year-old, there are certain things which that stuck in our mind. We have no idea. For example, no one can say that when he started to get an idea about certain things, at which age. For example, if I ask a person, at which age you understood that this thing is bad and this thing is good? At what age? at the age of 4, at the age of 6, at the age of 8, at the age of 10. At what age a child or a person start to understand what is bad and what is good? So what is a bad seed? Today I'm going to first talk about bad seed. Now the bad seed is something we call negative. For example, our mind, gets bugged with the bad information, like jealousy. When as a child, for example, a child is 6 year old, and there comes a new child in the family, brother or sister, is seed developed in his mind that my mother doesn't love me anymore, and the mother loves more my small child than me. This is called bad seed. And nobody understand, nobody can see this is a bad seed which has entered into the child mind. So what are the bad seed? Jealousy, envy, negativity about like nobody loves me or I'm alone in the world. These are the bad seed which enter into the mind, and later on you know you come to know about it. So for example, a patient who is coming to you at the age of 40, and you want to know the past history. So what kind of past history do you want to know from the patient who is suffering at the age of 40? He comes to you. So we want to know about the bad seed and good seed. The bad seed is that if he knows there is something wrong happened with him in the past, so there could be that there are some incidents had happened in the past which stuck in the mind and they never go out of the mind. And there are many things which goes away from the mind. Now, so there are bad seed like negativity from the family member, for brother, sister. It's like a kind of a anger, jealousy against somebody, or something wrong happened to him. It's like abuse in the life. Most of the cases, that there are abuses in the childhood. And these are some bad seeds which are, stuck in the mind, and the patient doesn't know how to talk with somebody, whom to talk with somebody. And this is here we are. We are here to explore the bad seed of the patient. We want to know what has happened with you during the childhood. But the problem is that if you are asking a patient, tell me what has happened to you at the age of 10, at the age of 12, at the age of 6, it is not possible that he can be so accurate in giving information. So we have to believe, we have to talk with the parents, that if there is something they have noticed in the child at the certain age. But when the child, about 15-year-old, 16-year-old, he can pass on the information that yes, there is something bad happened or bad seed. And if that bad seed he's still carrying in the mind. So the first information today you have to learn is what is bad seed, bad feeling. So there are the bad feeling or bad seed in the human being, which they carry on. So what happens when you start a case, when you start a new case, you have to ask the patient if there is something in the mind which he's carrying from the childhood or carrying from the adulthood in the mind. So the bad seed grows into the tree, and the tree later on grows into the necrosis and start to give the problem. So there is always a small bad seed which causes a big disease. Like you can say a genetic disorder. Genetic disorder is like a small seed somewhere, an error in the body, and later on it develops into a problem. And the problem is named as a genetic disorder, and the patient has to live with it. Now there is a good seed. Good seed means good feelings. Like for example, everything is nice with my family. My mother was very caring. I have given all the opportunity in the life to develop. And the bad seed is that nobody understood me. I have never got the chance to develop myself. And the good seed is that no, I have got the opportunity in the life to develop myself. My family my family was rich. And the bad seed, my family was poor. My father was very poor. And that, that image you carry whole life. My father was very poor. We were from the poor family. So what we are trying? We are trying to be sympathetic with ourselves. We are trying to be sympathetic for us. Oh, my father was very poor. I was very hard life. I had a very poor, childhood. I had this. So what you are carrying? You are carrying a bad seed, and you are sympathetic to yourself. Are you getting my point? And then there is a good seed that everything is nice, everything was good. I had no problem in my life. I developed very nicely. And now when you hear, so we call it a feelings. So there are good feelings and the bad feelings. And in what we do in Sehgal method, we interpret these bad feelings and good feelings together. For example, if a patient says, I'm not worried about my problem. This is a good feeling. I'm not worried about my problem. I don't take my problem seriously. I always remain happy. This is a good feeling. And if a patient says, no, I always cry. I always, think about my family, what will happen to them. I fear if I die. I have lots of anxiety. These are the bad feelings. But we have to consider both bad feeling as well as the good feelings related to the sick state. So when a patient comes to you, both sides we have to take care of them, bad feelings and good feelings. And then accordingly, we have to choose the rubric, and accordingly, we have to select the simile. So that is the part today we have to learn, that what is important with the mind. So what I want to tell you, that first we have to understand rubric wise. Okay, so today the medicine which I'm going to tell you and the information which I'm going to share with you straight away is from our clinical experiences. But if it was proved or not proved, I have no idea. But yes, there is information about this medicine in Materia Medica, like while telling you Gelsemium, I gave you the idea from the Materia Medica, which was written by different authors. And then I mixed with the rubrics. So Materia Medica rubrics, and then the clinical explanation from my clinic. So today we are going to learn about the remedy which is called Belladonna. Now, according to Dr. Sehgal, his own experience, and he had written this in his books, that Belladonna, he has seen up to 40% of the cases he treated in his clinic were of Belladonna. And that was very amazing for the homeopathic world, that how it is possible that we can pinpoint on one remedy for 40% of cases. Now, when the Dr. Sehgal was questioned that how you could say that Belladonna, is applicable in 40% of the cases, he said, I'm a researcher. And according to my research, according to my clinical research, that there are many patients who are behaving like a similar pattern. And Belladonna, there are many patients who behaves like Belladonna. And when they come, they talk like Belladonna. So that has convinced him that there are many patients out of 100, there are 30 to 40 patients are of Belladonna. And in my practice, somehow I also agree with him, because when I started to practice, I also started to see that there are many humans who are behaving like Belladonna or who are talking like Belladonna. So the history of this remedy is that the Veneticians named the plant Herba Belladonna from the circumstances that the ladies used it distilled in water as a cosmetic to brighten the eyes and flush the cheeks. Now here I would just like to tell you that when you read the history, and now what I'm telling you about belladonna in a clinical form, only from this slide, that belladonna patients, mostly, it doesn't matter male or female, they are more like a, that they like to be look nice. They wish that they should look nice. Now, I give you a rubric. So only from this small idea. Now, there is a rubric called vanity. Okay. Now, vanity is something like a vanity box where the ladies, they keep their cosmetics or the things which they can apply, like a lipstick, like a powder, like something you can keep in a vanity box. So, friend, just a simple start. I have not started the medicine yet. Only from the history of this medicine, that how it was used in the history, and there is a rubric called vanity. So the first information I want to give you, that the patients of belladonna, when they visit you, the first thing is that they are concerned about that, that, oh, doctor, that to be sick is not so nice. And they are very particular about how they look. Now, for example, most of the cases tell you about the acne, or that pustular eruptions on the face, or something which appears on the face, like that on the ladies there is a mark, or some kind of a facial problem on the face. Basically, they get very concerned about it. So what do they want? That that, for example, from a lot of cases, few cases are coming to my clinic with the problem on the face. I mean, they are not concerned about the problem on the stomach, on the leg, if they have eruptions, if they have some mark on the legs or arms, but they are concerned about the, the marks or something develop on the face. For that, they are very, very conscious. So the first appeal of the patient of belladonna, when it comes, that doctor, for me, that that there was a mark on my face, which I did not notice in the beginning. And I thought that I never noticed, that suddenly one of my friend, she just pointed out at that, oh, there is something on your face. And then I went into the, washroom and looked at the mirror and say, oh yeah, there is some mark on my face. And how come I have never, how can I did not notice it? Because I have been using mirror every day, but it never came to my mind that there is a mark on my face. Or maybe I saw it, but I ignored this mark because it wasn't so visible. Now, after my friend pointed out that there is a mark on my face, that, suddenly in my mind, it came that, oh, now it started to be seen now. Everybody can now look at my face and they can say, oh, there is something on your face. Your face is not looking so nice now. You had a very nice face. What happened to your face? Now, this is the one kind of condition of a patient who visit a homeopath, not because of the problem, just because the face is not looking good, or there is something which is now more visible to the people. And that brought the patient to you. So, friend, so basically we have applied this information in our practice many a times with success. So whenever a patient, male or female, if they come to me and they talk about the face, doctor, my face doesn't look so nice. The point for which I have come to you today is about my face. You see, there is a mark on my face. There is a acne on my face. There is a pustular pus marks on my face. I want that it should disappear. because I don't like to, go into the public like this. Now, and why the patient has come? Because it started to come into the notice of the people around him. Before, till the time when nobody was noticing it, nobody noticed it, the patient was not having concern to visit a homeopath or to get it better by any means. But the concern to visit or do something for the face comes after the patient gets remark from the close one, near one, or the people around him that there is something wrong with the face and your face is not so nice. So, first rubric which I already gave you called vanity, and the second rubric which brings the patient, which has brought the patient to you is there is a rubric called delusions, objects glittering. Now I will tell you and explain you this rubric. What is this rubric called? Delusion, objects glittering. Glittering means that like a gold, shiny. It means that it comes to the notice of the people. So only see why I use the word delusion, objects glittering. So there are three words: delusion, object, glittering. Now, what happened with the patient? Only one friend in the office or one colleague or the mother or somebody just pointed that, oh, what is there on your face? There's something not good. What is this? And now the patient who was unconscious about it or not thinking about it, maybe she has seen it, but it has never come to her mind to address it, to check it, to do something for it. When she got the idea from outside that there is something wrong on the face, and the patient immediately go to the washroom or near the mirror and look, oh, what is this? Oh, there is something bad on my face. Oh. And now patient becomes conscious. Oh, I have to do something for it. The first thing is to take a powder and apply it so that it should not be visible. Okay, that is the first reaction. The first reaction is that, oh, so what to do? Apply a powder. So next day, when this lady has to go to the office, the first thing she will do is to apply the powder to conceal it, not to be seen. So what is bad for this patient? The bad thing for the patient is that now it is visible to the people. That is why she has to make it better. Till it was invisible for the people, there was no need for the medicine. Now, because it is visible to the people, that is why she has to visit a doctor. You know that this is the mentality of the people. They are not visiting the doctor because they need the problem to get better. They are visiting to the doctor because the people are saying wrong about them. That is the need. So what is more important? The mentality of the people is more important. That is why we are using mind rubrics. Now, but only thing is that this is clear that the patient is telling you in simple word, doctor, I have come to you because now my problem is more visible to the people, and the people have started to point it out at my face that there is something wrong. Maybe like a leukoderma, maybe like a vitiligo, maybe like a, pregnancy marks, or maybe something, and that makes especially the ladies, they get more afraid, they get more, worried about something on the face. So the patient, if patient, the belladonna patient says, I don't mind having marks on my any part of the body, but doctor, I don't like to have mark on my face. Number one. And then you ask why you are worried about the face, why not the other part of the body? Because doctor, everybody can see this. And now, people started to tell me. Now people started to point out me, oh, you have a mark. I don't like this. So the rubric is clear maybe now. Delusion, objects, glittering. Glittering means that now it is coming into now they are visible. People can see it easily. Because, for example, I keep a stone. I keep a stone at a distance, or a gold at a distance. Okay, I keep a small gold at a distance, very, very far. Okay, you can't see it in the dark. But when the gold has a light on it, I put a gold and then I put the light on it. What happened then? It glitters with the sunlight. It glitters. That is the glittering. So what happened now? Till then, so when nobody has observed the mark on the face, there was a dark. It means it is a dark light. Nobody was focusing on it. But the moment other people's eyes start to see this like a sunlight on the gold, it becomes glitter. And then everybody start to ask, oh, what is this? What is this? So a belladonna patient, the first point, there are many, many doors to belladonna. The first point for the belladonna is vanity. Vanity means what? To look beautiful, to look nice. So how a belladonna patient talk about vanity? Oh, no, doctor, you know that in my life, I always wanted to look nice. When you look nice, you know that people admire you. They are friendly with you. But if you don't look nice, nobody talks with you. So what is the priority of a belladonna patient is to look nice. So two rubrics which brings to you about belladonna with acne, with pimples, with the mark on the face. Mostly these cases are coming to you and you can prescribe belladonna because of the two rubrics, vanity and delusion, objects, glittering. What is object? Object is it any kind of a substance. Object is non-living, maybe a mark, maybe a acne. This is called object. So this is how I have learned the rubric and we started to apply. And now I cannot say that the prover have used this object glittering the same way which I'm telling you. But I think it is a more successful way for me to explain you. And maybe you agree that, oh yes, I have seen such cases in my life. In my patient, they also talk like this, doctor, today I have come to you because there is a bad mark on my face. Otherwise, I did not come to you. I only came to you because of, there are few pimples on my face and they look not so nice. You can think about belladonna. Okay, number one. I'm trying to tell you everything in a coordination with what is written by the prover or the history. But I gave you the rubric, beyond that. Now, next slide. Belladonna is intensely poisonous to man, causing problem to memory. Now, that is another thing which is written that it affects the memory of the people. Now, which rubric we can use for this? That if belladonna patient, when you become a belladonna patient, how you become a belladonna patient? Have you eaten the belladonna and then you became belladonna? If you become arsenic after eating arsenic? No. When you become sick, please understand, when you become sick of a disease or a symptom or something appears in your body, something attack your body like infection, like bacteria, like parasite, something when attack your body takes certain changes. Okay, it start to make certain changes to defend. Body has to defend against infection, against bacteria. So when the bodies attain certain defense mechanism, in this process you see that certain things develop as a signal. Now, what are the mind rubrics? The mind rubrics or the symptoms which are given in the Materia Medica about a remedy are nothing than signals. The body is exhibiting to tell you that, oh, these symptoms belong to belladonna. Are you getting my point? I mean that if the body doesn't exhibit or if the patient will not speak like I told you about glittering object, I will not recognize belladonna. But how it is possible that after becoming sick, the patient starts speaking like belladonna? And if I have no idea how belladonna speaks, how belladonna shows the things in gesture, I cannot understand belladonna. But if you only try to understand a remedy only by symptom, pathological symptoms, you will not understand the remedy very well. So the therapeutic way of understanding a remedy or understanding a remedy from the clinical aspect through mind rubrics, you have to understand what is mind rubrics. Mind rubrics are just a signal which is emitting from the mind, and we are decoding these rubrics, opening and try to understand what the patient want to say. So a patient becomes belladonna after the brain start to exhibit certain kind of signals through speech and gesture. Okay, so now when a patient is belladonna now, and what I told you that belladonna, if taken as it is a poisonous, and it will affect the memory. Okay, so what happens that when a patient becomes belladonna patient, when a person becomes belladonna patient, so it is clear that somewhere his memory also get affected. Okay, now is there any rubric about this? How I understand the patient who is sitting in front of me is belladonna and his memory has got affected? So there is a rubric. So when a patient's memory get affected, which rubric can come? There is a rubric come calculating inability food, inability to. See, there is a rubric calculating inability to. Now, do you think that this rubric is appropriate to use for belladonna? When the memory is weak, as I told you, it's a proving. In the proving, it is known that belladonna as a medicine, as a drug, has the ability to affect the memory. Okay, so we have a rubric. When the memory is affected, I cannot calculate. It will take away my ability to calculate the things. And this is a very good rubric of belladonna. How to use it? The first thing is that now you will understand that how we are applying the rubric according to the proving which is given. But the rubrics are there. But nobody used it before Dr. Sehgal properly. Now, the one thing about belladonna is that second thing. First, I already cleared with you about the glittering object. Now, I'm giving you the second aspect, the rubric calculating inability to. Now, what is the word inability? Inability word means that patient has lost the ability. For example, when I'm healthy, okay, when I'm healthy, I have an ability to perform many things. I can do this, I can do this, I can do this because I'm healthy. But when I become unhealthy, when I get affected by a problem, it could be any problem. It could be cold, it could be chronic disease, it could be skin problem, it could be diabetic problem, it could be BP problem, any problem, okay? Genetic problem, heredity problem, autoimmune disorder, whatever you say, okay? You can wrap the person with any kind of disease. But when a patient gets affected by the disease, and if the patient is belladonna, the mind starts to be weaker, because we learn that the belladonna minds get affected if the patient takes in the proving belladonna, the mind gets affected. Okay, so when a patient becomes a belladonna patient, what happens? The first thing is that it is very hard for, okay, to start a case. You ask a patient, since how many days you have been suffering from this disease? Number one question, please write. If you want to understand belladonna, immediately, the first question when you ask a patient, from how many days you have been suffering from this problem? Now, the answer, what is your question? How many days? So it is a mathematical question. How many days? It's a mathematics. I mean that, oh, he has to understand how many days. And how much the problem has grown further. Like from it was 1% problem, say 1 month ago, and how far the problem has grown. This is again a mathematical question, isn't it? When you ask a patient that, okay, you have this problem for last 2 months, and in the last 2 months, the problem is still the same or is growing. So here the patient has to apply the mind. But the problem with the belladonna is that he cannot apply his mind, though he can. But now because he's a belladonna patient, he cannot. Okay. So what the problem start when you ask the patient how many days. Now he could do it earlier, but now he cannot do it. Oh, how many days? Oh. Maybe 10 days. What do you mean, maybe 10 days? You have to tell me accurately, 10 days or more. Maybe 12. Now, what is 12? Is it 10 or 12? I have to ask my wife. I have to ask my husband. I have to ask my son. He knows me. Hello, son. How many days I have been suffering this problem? But why you have to ask your wife, son, or husband? It is your problem. You have to tell me since how many days you have been suffering from the problem. Why you need help from somebody? Doctor, I don't know what happened to me after becoming sick. Earlier I could tell you, but now I don't know what happened to me. Now, if you ask me a question that how many bread I have eaten in the morning, and if you ask me a question that what I have done yesterday, it is very difficult for me to tell you that how many days and how much the problem has grown. Maybe 10%. Are you sure? Maybe 15. But doctor, it's very difficult to tell you how many days, how much time. So this is the rubric called calculating inability. Now, this inability is not the born problem. It's not an inborn problem. It's not a heredity problem. It's not a genetic problem. This inability has come into the patient due to the sickness or so-called disease. So the patient says that when the patient tells you, doctor, you know that before getting sick, before getting fever, I was very intelligent. I could tell you immediately like this. Immediately like this. I had the power to calculate the things very quickly. But now after becoming sick, this power has gone down. Now I cannot calculate even the simple things. Now, for example, you have not given the belladonna to this patient because you have no idea which rubric to use about this. You have no idea what the patient is telling you. You ignore it, throw in the dustbin. You have no idea what to do with this kind of words. When the patient tells you, doctor, it's very hard for me now to remember the things, very hard for me that how many days I have been suffering from. I have to take the help of my wife. I have to take the help of my husband. You have no idea. Maybe you write it, memory weak, minus. You can note this, but I don't know how you use it. So what happened with the patient is that there is no defect in the memory. There is no defect in the mind, but there is a problem affected by the problem, and the mind is not able to use it properly. So this is the rubric we call calculating inability for while the patient is sick. So what happened there? For example, you have not given the belladonna because you don't know how to use it, and you have given pulsatilla, you have given Cilicia or ABCD medicine. So the next time when the patient will come to you, belladonna patient will come to you, the first thing he tells you, oh doctor, what is this? Your medicine did not help me. I thought that you will give me the medicine and the next day I will be getting better. But what is this? Your medicine did not help me. Because you have not given the belladonna. So the result is not there. So the result of the remedy you only will get when you give the simillimum, but not the therapeutic. But it can be possible. It can be possible that you have given a remedy which is sharing the same rubric like Belladonna, okay, you get the result, but not the desirable result. So there are two kinds of result. The result, which is you get it, but this is not desirable. And the other result is desirable result. And what is desirable result? Oh, doctor, this medicine is very good. I never got such a medicine. I have been coming to you for the last 3 months. And every time when I take the medicine, something happens. But this medicine which you gave me, wow, wonderful. Though my symptoms are same, but I feel that this medicine will help me, definitely. This is called desirable result, which we need in homeopathy, so-called cure. Now what happens that the patient comes to you next time. Even if you have given the Belladonna, for example, but the patient is still not get cured properly. It is only the medicine has helped 30%. Mind and body together. When the mind is getting better, simultaneously there is a result of 30% or 20% in the physical level also. Please understand. Again, if you are giving a medicine, there is a 50% change in physical level. And there is only 2% change in mind level. This is bad remedy. But if you give a medicine which shows 30% change at the mind level, and simultaneously there has to be change at the physical level also, maybe 10%, maybe 20%, maybe 30% has to be there. It's not only mind has to get better. This is wrong. Mind plus physical also has to get better, but it could be that proportionately the mind gets better more than the physical level. Okay. Now, when a Belladonna patient is coming back to you, 30% change, and you ask a Belladonna patient, how are you? Now, the calculating inability for the rubric is still there. It's not vanished. It is still has affecting the mind. The mind is not completely gone, that the memory is very sharp tomorrow. Okay, memory can be improved after the remedy, but the calculating inability rubric will remain there till the patient fully get better. Please understand, the rubrics remain there till the patient fully get better. You will see the seed of the rubric in the last also, very small seed. So when the patient comes to you first time, the seed is like a grown seed. When you give the medicine, this grown seed is going to the seed level, and then it becomes so small, it's invisible, but it is remain in the mind. It never disappear. It never disappear. It is always in the mind there. So, friend, all human beings have the problem of calculating. Everybody has a problem of calculating, but it could be seed or it could be a grown seed. Okay, we all have. We all have the problems. We all have fears. We all have anxiety, but it's like a seed. When we are healthy, all the things which are in the mind, they are there like a seed. When we become sick, few of the seed, they grow with the problem. And when we give the similimum, this seed which have grown unproportionately, they go back to the level of seed and stay in the body. So you never get rid of fear in the life. You never get rid of the anxiety in the life. It is always there. But you can never be affected by this because now they are only seed, little bit seed in the body. Okay. So now what happened that when the patient comes to you second time and he got 30% relief, but for the Belladonna patient, it is very hard. When you ask a Belladonna patient, how many, how are you? I think I'm better, doctor. How much you are better? Doctor, what you do that, you repeat the medicine. Because it's very difficult for me to tell you now that how much I'm better. Maybe 25, maybe 30, maybe 35. So it's better you repeat the medicine. And next time when I come, I will tell you. So what we'll see that the seed is half. Calculating inability is still there. So in the same manner, when you are treating a lady with the acne or pimples, and when the lady tells you that, you know, that the reason for me to come to you is that the people started to ask about my acne, my pimple, and this is not good for me that people should see this. I don't like that people should see my problem. This is the problem. And now when you give the remedy belladonna, and the next time when this lady comes, don't look at the acne or pimple. This is not our problem. Acne, pimple, or face on the mark on the face is not our problem. Now, our problem is that the idea. So what I'm going to ask the patient says, doctor, still you see, I have some acne. Few, two. There were 5, there are now 2 left. But but today, if you are thinking about that the people will look at it, no, doctor, I think after the remedy, after 24 hours, after 72 hours, this idea that the people are looking at me vanished. Now I'm very comfortable. But sometimes I apply the powder, little bit. Sometimes I forget now. But earlier, before coming to you, I was very particular about the powder. I have to apply the powder properly and to look. Nobody can see. Then I asked my mother, oh, if it is okay, nobody can see this. But now I'm bit calmed down. I don't apply the powder like a mad person. So what is the difference with the medicine? The medicine has reduced the madness that the person has to be so conscious about the face that she can't go outside without the powder. Now, after giving the remedy, what is the change? The acne are still there, but the patient start to go out without or little powder. So what is the change is that the medicine has removed the blockness and made the understanding. The medicine has brought the understanding in the mind of the person that the acne are better and they are not so visible. Even if they are visible, there is no problem. So when you ask the patient, what is the change after the remedy? About the thinking, then the patient, if the patient replies you, doctor, I'm calmed down now. I don't think so much. Let the people see. I don't care. This is a very good effect of the medicine. Even if the acne and pimples are there. So next week, pimples disappear, idea disappear, patient disappear. Finish. And everything is okay. The patient can have pimple or acne again. That's not the problem. So the next time when the patient will come, you give the belladonna in the next potency. Because you know the patient is belladonna. But if we have to give the next potency or not, I'm covering the issue of the potency together. Now the idea is that, for example, you started the case first time with belladonna 3 for acne, pimple, or marks on the face, some problem. And the patient has got better. The idea is okay. Patient is not too much concerned now. Problem has disappeared slowly. There is no problem. And this patient comes to you after 6 months with the same problem. Acne, pimple, again the mark on the face. And this time again, you have to confirm from the patient about the idea. And you have to remind the patient, are you still thinking about that the people will look at it? Are you still thinking that the people will talk about it? And if you have come today just because the people have started to look at you, or it is your own idea to visit me? Oh, doctor, no. Today I just come to you because when I saw in the mirror, then I saw that there are 2 or 3 pimples on my cheek. And I thought that last time when I took the medicine from you, you gave a very good remedy and my acne disappeared. So I thought, let me go to the doctor and take the remedy. But the mind is okay. No anxiety in the mind, no fear in the mind, no rubric of vanity, no rubric of glittering, nothing. So what to do now? There is a physical disturbance, but the mind is okay. So what I will do? I will not give the medicine. I will leave the patient. I will not give the medicine. I will give a placebo or leave the patient, because this problem, because the medicine is already given to the body and the body will handle it. It can, see, acne and pimples can reappear due to bad food, bad weather, or something the patient has done. But the patient mind is still not affected by the acne or pimple. Mind is not affected. So there is no need to give any medicine. Leave the patient for 24 hours. Okay, report me after 2 days. Report me after 3 days. But after 3 days, the patient doesn't come. And maybe by chance you meet the patient somewhere and you ask the patient that, second time you came to me, I asked you to report me after 3 days, you did not come. Yes, doctor, because the acne disappeared without medicine. This is called the medicine which you have given the first time is still in the body, and help the disease to go out. But in case the patient tells you, oh doctor, yes, this time also the same idea. My colleague pointed out, oh, there are acne on your face. There's a pimple on your face. And that again, I thought, oh, let me visit you, because first time when I came to you, you gave the medicine and all my acne and pimple disappeared. But the idea is that, oh, now it started to, everybody see it. Okay. So the seed. So the first time I gave the medicine on the seed, mental seed, which grown up, and the seed becomes again small, but it was in the body. So again, then the problem came, this seed grown again, okay? And the patient came back to me because the seed is there. Now what I give the next potency of the same remedy. If I have given Belladonna 3, now I will give Belladonna 6, simple. And now again this grown idea will go this, and patient disappear. Because the idea disappear, problem disappear. And after 2 years, the patient comes back. Same situation. Acne appear, or this appear, or this happen. Again, if the idea is there, next potency. If the idea is not there, no, nothing. Just go away. So the selection of the potency depends upon the action of the first prescription. The action of the first prescription suggests the next potency. So every time when a patient comes to you, the physical symptom can change. Physical symptom can change. Today you are suffering from this. After 6 days, suffering from some other problem. After 1 year, another problem. After 2 years, another problem. Those are physical symptoms can vary. They can change. But the mental state doesn't change. It means that, for example, today I have given a medicine Belladonna 3 to a patient and his present symptom disappear. Okay, for whole life, cured. It got cured, finished. But after 1 year, patient develop another acute problem or a chronic, something develop again, new thing, something new. And the patient reports to you with a new problem now after 1 year, 2 years. Now, classically, you have to take the case again, study the case again. All the things which you have done in the past, you forget about it. You start to find a new remedy, miasmatic remedy, genetic remedy, modalities, and this you try to work out again. Find a new remedy for the new problem. But in Sehgal method, there could be a new problem. But what we believe, the mental state is old. So the mental state comes back with the new problem. Mental state. So the thinking about vanity, glittering object, calculating inability for these kind of mental state, they reappear with the new problem. Now, what only have to see is that, oh, last time I gave Belladonna 3. If the patient is still Belladonna or not, that's only my job. I'm not going to look into finding a new remedy. Rather than I try to understand if the patient is of the same remedy or not. That is the first idea. Now, what I asked the patient last time when you came to me, and I asked you a question, from how long you have been suffering from this problem, So today also I ask the same question. Since how long you have been suffering from the problem? How many days are there? How much the problem has grown? Can you answer me now? Oh, doctor, I think no. It is the same story now. Now the patient says it's the same mental state now. So what I do, because the mental state is the same, symptoms are new, but I give Belladonna next potency. Okay, this is how I change the potency. I don't change the potency if the physicals are bad, but mental state has not appeared yet. I have to wait. I have to wait for 1 day, 2 days, 3 days, 5 days, 1 month, till the mental state come back. Mental state gives you the signal that there is nothing wrong in the health structure. Only new symptoms have appeared, but the body as a whole is capable of fighting it. I understand. So mental state gives you the signal. When the mental state are heavy, patient is emotionally more involved, patients start to cry, patients start to weep. It shows that your body is not capable of fighting the infection, the virus, the bacteria, whatever. When your mental emotions are hard and patient is mentally strong, it means that the body is capable of fighting the problem. So don't interfere. Let the body fight. Okay, these are the signals of giving the remedy and not giving the remedy. It's not like allopathic medicine that when the patient reports you that there is another, now doctor, infection reappeared, and the patient goes to allopathic doctor. Okay, now the doctor gives 5 days antibiotic course again, because the same antibiotics was given in the last time, and the patient takes the antibiotics course for 5 days, but this time the symptoms are not disappearing. The doctor gives another 5 days antibiotic. Symptoms are not disappearing. Again 5 days antibiotic. Symptoms are not disappearing. Because the body is trying to fight its own battle. Why to give antibiotic? But nobody understands this. Only homeopathy understands. So we don't need to interfere when the body is capable of fighting its own battle. Don't interfere. Let the body fight. This is called a natural way of treatment with homeopathy. If we start to give the medicine like allopathy, every time the patient comes antibiotic, every time the patient comes, we have to give pulsatilla, every time medicine, then you are doing the allopathy. You are not doing homeopathy. So the homeopathy way, we think that once you have given the similimum is capable of handling the problem on its own now. Forget about it. Just relax. But our job is to find the similimum. And for that, we have to be very accurate. But if you are not accurate, if you are not able to understand the man, you fail. And when you fail, patient will suffer. That is the problem. So next point now. So how I'm taking you from one point to another point with the rubrics. So here you see that only up to this slide, I have told you so much about Belladonna, in spite of not, I'm showing you the rubrics also, that how poisonous is the issue with the Belladonna toxicity. Next point. Now, Romans and Scots used the plant as a weapon against their enemies. Now, how this can help my case? Roman and Scottish people, they use this as a weapon against their enemy, because it's a poisonous. So maybe they put in the, in the arrow, and the arrow they put the poisonous, and when they hit, it hit the body and it becomes poisonous. So it could be the problem. Now, what is the quality of of this rubric? If there is a rubric that that Belladonna has a quality of fight wants to. Though it has nothing to do with this slide, but I'm just showing you because it shows you the rubric also. Delusion, war, being at. Delusion, war, at being, and fight wants to be. Now, friend, there's another aspect of belladonna. Belladonna usually is a very, as a patient, not as a person. You could be as a person belladonna also, no doubt. But as a patient, belladonna, he expect the first thing about belladonna. Now the third point. The third point about belladonna, when he visited doctor, he comes with a recommendation. Somebody recommend him. Oh, go to Dr. Bahare or go to Katie. She's a very good doctor. And whenever she gives a very good remedy and you take the medicine and next day you will get better. People promise like this to friends. They tell them, it's very bad about the people to tell somebody like this, go to this doctor, he will give you a very good remedy. Next day you will get better. And the patient is very happy. Oh, wow, 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 wow. And he comes to the doctor. Doctor, give me the same medicine which you gave to my friend. I also want to get better by tomorrow. That's a stupid idea. How can I give you the same medicine for your problem and you will get better tomorrow? How is possible? But this patient is a very, easy believer. Belladonna has a problem that he is a very easy believer patient. Whatever idea, whatever somebody tells him, without any suspiciousness, he takes the idea. For example, if a belladonna patient is traveling in a train and there is a next passenger sitting and he tells the belladonna patient that, oh, there's a problem. I see you have a problem. Yes, I have a problem from many months. I'm not getting better. Oh, I know a doctor. There's a Dr.M.L.Sehgal in India. He's a very good doctor. And you know that he's very experienced. He has cured many patients. You must visit him. Oh, give me his phone number. Now, this is belladonna. Immediately take the phone number. Give me his email address. And immediately, before reaching home or from the train, he called, Dr. Sehgal, I got your recommendation from a patient sitting in the train. And he told me that you are a very good doctor. You treated him. I want to be treated by you. Just like that, you heard something from somebody that there is a good doctor and you immediately contacted me. Yes. The moment I hear that you are a good doctor, there is a... So what is the habit of a belladonna patient? The moment he hears from somebody that there is a good doctor, there is somebody who can cure him, there is somebody who can make him better, he immediately take the idea. And he never suspect the idea. He never think the idea could be bad. He never suspect that the person may be cheating him. He never suspect that the person may be telling him false. No, he immediately called the doctor. So this is the another information I'm giving, the number 4 information, that this patient belladonna, they mostly visit a doctor from a recommendation which is not fully proved or fully verified. He never verifies the information. He just take the information and reach to you. So we have rubrics about this. I'm going to tell you 2 rubrics. There's a rubric called credulous. I will tell you about this rubric now, credulous. Now the credulous people, they are, that whenever somebody suggests them that there is a good doctor, they easily take it. They don't suspect that maybe the person is cheating them or not. They only want to try. So, that belladonna patient, when you ask a belladonna patient, you already have taken medicine from many doctors already, and you have not got result. Today you come to me just by knowing that there is a good homeopath, for example, in Tehran, and you just dropped in the Tehran, immediately you travel to Tehran without taking appointments. Sometimes they don't take the appointment. They just call the doctor, doctor, I'm coming. Oh, wait, I don't have time. No, doctor, you have to treat me. But I don't have time for you. I'm busy. No, doctor, you have to treat me. You know, this is called fight. They want to fight with you because they want to get the result. No, doctor, you know that it's very urgent. I have to show you. I know you are a good doctor. You have no time, but you have to see me. But the doctor says, I can't see you. So the most of the belladonna patients, they have a habit to visit you or call you without appointment because they just hear that there is some good doctor. They just want to meet you. Doctor, please give me the earliest time. The earliest, maybe after 1 hour. Oh no, I can't see you till next week. Oh no, it's not good. You have to do. Please see me. See me tomorrow, at least tomorrow. No, I can't see you before next week. Oh no. How can you say this? What do you mean? How can I say this? I have no appointment. I can't see you before next week. But doctor, I have to come. No, you can't come. I have no appointment for the last 1 week. No, doctor, it is not good. What is this? You are a child? I don't have appointment. But doctor, you know that I'm going to die. I will die. How will you die in 1 day? So he tries to talk with the doctor like a child. So belladonna patient is a child. He start talking like a child. He start behaving like a child. He start asking for the relief from the doctor like a child. And you know that there are many people, the family member of belladonna. For example, they tell you that doctor, when my son or my husband or my wife, when they get sick, they start behaving like a child. Oh, please sit here. Please don't go for work. Oh, I like you. Please don't go today. Please don't work. The wife says, I have to work. No, don't go. Cancel the appointment. Sit with me. Please sit with me. This is the way belladonna start behaving. Okay. Now, belladonna behavior is like he's very credulous. He's very naive. He takes, things very easily. Okay. So we go to the next point. Now, according to Dr. Kent, the mental symptoms of belladonna are delightful to study, but dreadful to look upon. Now, the basic mental character found in belladonna, rage. I will talk about that, how the rage is there in belladonna, mania, delirium, delusion, desires, mood. Belladonna has, has a repulsive mood. He has a rage. He has a desire. He has a delirium. He lives in many ways. So Dr. Kent thinks that he had an idea that is good structure of belladonna, but it's not so easy to prescribe. So what Dr. Sehgal had done, he made the applicability of belladonna so easy that he started to find that the belladonna is more and more patients are coming to his clinic and they are reflecting like belladonna. It's not that we are making belladonna in our clinic. The people are talking like belladonna whenever they visit to the clinic. So from there, he got the idea that belladonna is more applicable to 40% of the cases. Now, this patient is a light-minded person. Number 5. This patient is a light-minded person. His reaction toward the ailment is mix of no seriousness and showing sensitivity with fear, which is short-lived and temporary on the mind of belladonna. Now, there is a rubric, indifference alternating with sensitiveness. Now, I must tell you this important rubric. Now, you know what happened with the belladonna, that when the problem starts, it is a nature of the people. Many people, they have a one side of one, like many people, they have thinking like they think same. When the problem start, oh, what is this problem? Shall I go to the doctor or not? Shall I wait? Maybe I wait. Oh, this is nothing. Oh, this is a very small problem. I should wait for this. Or sometimes they even don't notice their problem until it is brought into their notice by somebody in the family member. then they only realize that they have a problem. And unless they have no, their serious symptom, they don't consider their small problem like a sickness or like an illness. Okay, so the most of the tendency of the human beings is the most tendency of the human are to ignore the problem, to wait and watch for the problem to grow, not to think about the problem, to avoid the doctor, to avoid the medicine, don't like to go to the doctor, they don't like to take the medicine. Now, these are the things which we hear from the patient after they suffer from a long time. One of the things, for example, you ask the patient, why you did not come to the doctor before? Why you did not come to me early? Why you did not take anything? Why you did not do anything for your problem? The common answer, very common answer is, oh, doctor, I don't like medicine. Have you heard this? Yes or no? Very common answer. Yes? So how many agree with me with this answer? Yes. Okay. All of you agree or few agree? Okay. So that is the one of the commonest issue with the people, that why I don't like. Okay. Next thing is, I don't like to visit a doctor. If you heard this or not, I don't like to visit a doctor. This is another answer. I like to wait. Doctor, I don't visit a doctor very easily. Third line. I don't like to visit a doctor, earlier. I wait. I'm not the one who visits the doctor so quickly. Now, this is another thing. I hate medicine. Another thing. So the patient, as a patient, they develop their own idea, which has nothing to do with the reality. I don't like doctor. Why you don't like doctor? I mean, if we are dinosaur, what is wrong with the doctor? Bahrain, what is wrong with you as a doctor? If you look horrible, if you are a monster, tell me, Bahrain. When a patient tells you, I don't like a doctor, so you must ask the patient, what is wrong with the doctor? If the doctor is a monster, if we are a dinosaur, what is wrong with the doctor? No, I look horrible. So I asked the patient, what is wrong with the doctor? Why you don't like to visit the doctor? We are here. One person says payment. Okay, this could be that you don't like to. First thing is that what is wrong with the doctor? The second thing, I don't like to take the medicine. Why you don't want to take the medicine? What is wrong with the medicine? What is wrong with the medicine? Because medicines are harmful. They create lots of problems. They have side effects. So people think about in their mind, they have their own image about medicine, about treatment, about doctor, about disease, about sickness, or it is very costly, why to go to a doctor to pay the money. So everybody has their own idea. And we have to, now the problem is we have to decode this idea. Now, what is belladonna? Now, when you ask a belladonna patient, why you did not come earlier? Oh, doctor, I don't take the things so like people. I'm not like other people. Number one, I'm not like other people who rush to the doctor immediately after getting the problem. I'm not like this. I think that, for minor problem, I don't like to go to a doctor. Yeah, till the problem becomes something that you need a medicine and it stops your working. When I feel that, okay, now the problem stop me from working, or it will not allow me to work, or something that it will do to me, then only I think that let me go to the doctor. So the first stage is indifference. So the rubric is, what is the rubric? The rubric is indifference alternating with sensitiveness, which I showed you. Okay, let me show. So there are two words: indifference, alternating, and sensitiveness. It means that one time he is in a indifferent state. After some time, this state replaced by sensitiveness. So what happened that first Belladonna thinks that the problem is nothing to do with that. I mean, there is nothing to do now, nothing to just leave it. Now, for example, I have a backache. Okay, I have a backache. Oh, what is this? Oh, so painful. Shall I go to the doctor? Oh, it's better. Oh, it's okay. I wait. So now I become indifferent immediately. Okay. And now I start working. And after 2 hours, again the pain appears. Oh, maybe I have to go to doctor. Ah, it's okay. No, I don't need to go to doctor. Now, the patient says that, doctor, I used to feel pain here, here, here. I make some exercise and then it disappears. And then I say, oh, I don't need that. So indifference and sensitive. He's sensitive when the pain appears. When pain disappears, he becomes again indifference. Now, what happened that this rubric we can mix with calculating inability, because the patient has a problem of calculating inability and he could not calculate whether he has to go to the doctor or not to go to the doctor. Now, mostly what happens with Belladonna that, for example, the patient says, doctor, 15 days ago, suddenly I had a problem. I found there's a pain in my shoulders. One day, suddenly, I was, working, and then I thought, what is this? I made some exercise, and then it disappeared. It was there for 5 minutes. Next day, when I woke up again, I felt the pain again. I did the same. And after a few minutes, not 5 minutes, after 10 minutes, the pain disappeared. After 4 days, the pain again appeared in the morning. And this time it was more than before. I did some exercise, but it took 10 minutes, the pain to disappear. Now, after 5 days again, when I got up in the morning, I could not lift my shoulder, arm. I could not lift because the pain was too much. And then I thought that, what is this? Something is wrong. I have to go to a doctor. Now, this is called a sensitivity of a patient. And what he did before 10 days, till 10 days, he remained indifference. Because the pain was disappearing, coming, disappearing, coming, disappearing. So he did not think of visiting the doctor. Okay? And now, because the pain is there, stable now, and is not going away with exercise, then comes the idea, he becomes sensitive now, that it could be something bad. It could be, what is sensitiveness? It could be bad. I have to go to doctor. I have to take an X-ray. Maybe I need X-ray. Maybe I have to show somebody. Okay, let me go to the doctor. It's very painful. And now he comes to the doctor that, oh, doctor, you know that last 15 days, the problem was 1%. Then the problem was 10%. Then the problem was 40%. I thought that it will disappear. This is called indifference. I thought it will disappear on its own. Okay. But now the problem is now 60% or maybe 80%. I'm not able to move my hand. I'm not able to do the things as I was doing it. I think I need medicine. So I thought, oh, let me go to the doctor and ask. The first thing is to ask, what is the problem? So doctor, tell me, what is this problem? Why I have the shoulder problem? Why? So what is this sensitivity? The sensitivity is that what is the problem? How come he has a shoulder problem? From where this shoulder problem comes? So the patient is asking the doctor, number one, not the medicine, how the problem appeared. Doctor, can you tell me that how this problem come suddenly in my life? I did not have any problem with my shoulder before. It was very first time 15 days ago. Now, could you please tell me that how this shoulder problem? So now I ask the patient, if you have come to me to know about the problem or to take the medicine, what shall I do now? If you want, I only tell you what is the problem. You go home, or you want medicine? Both. No, I give you one. Either you take the knowledge of the problem or take the medicine. I will not tell you I will not give you both. Now he is stuck. Or if you want both, okay, as a joke, you can make a joke with Belladonna. Okay. You can ask the Belladonna, if you want the knowledge plus medicine, then you have to pay 2 times. First, for the knowledge, my charges are $10. To give the medicine, $10. So decide, you want both or you want one? Now he's stuck. What to do with the doctor? Oh, doctor, you take medicine, you take money for 2 things. Yes, I have to tell you. If I have to tell you, I have to apply my knowledge. For that, you have to pay me. But if you want only medicine, then I have to apply my mind. For that, you have to pay me. Okay, give the medicine. Forget about the knowledge. Are you sure you don't want knowledge? Take it. No, I don't want it. Take it. No, I don't want it. Take it. I tell you why you have a shoulder pain. No, I don't want it. Why you don't want it? No, it's okay. You give me the medicine. The pain should disappear. That's okay. So now, this first thing, when the patient is asking you, doctor, my first idea is to go to the doctor and to first to know how this problem has appeared all of a sudden. I want to know what is this, why I have shoulder pain suddenly in my life. I'm now 50-year-old. I never had any problem. All of a sudden, this problem appeared. What is this? Okay. Now, what is this rubric? This rubric is called light desire 4. Light desire 4. As I gave you last time, light desire of Belladonna. Yes? I gave you light desire of Belladonna. Oh, sorry, Gelsemium. Sorry, last time I talked about Gelsemium. Light desire for Gelsemium, positive. Positive. Now, what is the light desire of Belladonna? Now, light desire of Gelsemium is to know about if the problem is curable or not. Cure, the word cure. This is a light desire of Gelsemium. Mariam, why you are moving? Like a trance. So you are in a rubric trance. Now you are mesmerized. You know how I observe everybody like you. I am very observative. What the person is doing, what he's smiling, she is not smiling, she's smiling, what we are doing. So I keep these images in the mind. And that is very important. When the patient comes to you, you have to keep the image in the mind, but not the patient. You don't have to eat the patient. You only have to understand the patient. The thing is that we start to eat the patient. Okay? Don't eat him. Just look at him, what they are doing. Like Galaxy Tab, he's now smiling very nicely. I never saw him. Now he wants to be seen. So you see that people are smiling at me. Maybe they like me now. Okay, this is my delusion. Okay, so the characteristic that what you learn from the patient is that What belladonna is? As I told you, Gelsemium light is pure and positive things, natural, positive, no artificial love, nothing. Everything natural from the heart. This is Gelsemium. Now, belladonna light is that he first likes to have the idea from the doctor about his problem, but not in detail. Okay, how I catch that the patient, for example, it is now this is also very generalized. It is very generalized that out of 100 patients, 95 patients, they ask you about the problem. This is very natural. Doctor, what is my problem? In how many days I will get better? If homeopathy has a cure about it or not? If homeopathy cure about my problem? If this cure, that cure, that cure. So the most of the time, the patient is asking so many questions from us before we start the treatment. He wants to know what will happen to him, if the medicine will have effect on him or not, when he will get better, in how many days he will get better. Is it right or wrong? Yes or no? Yes, Galaxy. Why you have a name Galaxy tab? Which tab you are? Galaxy tab 6 or Galaxy tab 8? Or your name is Light? Oh, his name is also Light, L-I-T-E. So he looks like a belladonna. See, he looks like belladonna. His smile is like a belladonna smile. And his name is Light. L-I-T-E. I don't know how you say Lite or Light. But anyway, he's my light of the day. Yesterday, last week, Bahare was the light. Okay. So what I was trying to tell you, I have a question. Okay. The question is that, yes. So this is, there are generalized things. The people are telling you, they are doing very generalized things. And this was one of the questions from many doctors in the beginning when my father gave this idea. And they say that how can you use this generalized term, because every patient say like this. So how can we understand whether to use it or not to use it? How can you use this generalized term that the patient wants to know about his problem? They ask about the problem. This is very natural. But Dr. Sehgal reminded them that the person who is giving you this information, who is asking this question, is a patient now. He's not a normal person. When a patient is asking this question, this is not a generalized term, then it becomes a peculiar. Then it becomes a symptom of a patient to ask you a question. You can take it's a normal, but it's not a normal. So whatever I'm telling you, that you may think that if every patient say like this, so if I give belladonna to everybody, no, you don't have to give belladonna to everybody. Whoever asks you a question, no, this you don't have to do it. The only thing is that the belladonna patient only want to know from you how the problem has developed. Number one, how the problem has developed. And if there is a medicine for his problem in homeopathy. Number two. Now, as a doctor, we have to be a little bit clever. And the clever is that, for example, I ask the belladonna patient, shall I tell you in detail about everything? Or shall I only tell you the name of the problem? Oh, doctor, just tell me the name of the problem. That is enough. I don't want the whole information. Now, that is the light desire of belladonna. Belladonna patient doesn't need from a doctor the whole information. He only wants to know what is the problem, and that is enough for him. That is one condition of light desire of belladonna. The second thing about belladonna is that he likes something soothing, very light music. For example, the patient say, doctor, whenever I get sick, I play a very, I like a music which I only play when I'm sick. Only. I play that music all again and again, again and again, again and again. Same music runs till I am sick. I play the music whenever I get tired. I close my eyes. but the music is still running in the background. Very small, very smooth. And this helps me a lot. So Belladonna likes light music. He likes light information. He doesn't like serious matter at all. He doesn't like to discuss about serious things during the sickness. And what he likes? Comedy. He likes comedy serial, jokes, light things. And what is the room of Belladonna? Which kind of light Belladonna likes? In his room? In his room, what kind of light has to be there in Belladonna? Nobody has. I have to show you. So wait, I show you what kind of a light Belladonna needs. You can see me, but the light is very dim and very little. Very little light. Okay. And it has to be not very close. It has to be very far, like a bedroom light. Very small, very dim light. So Belladonna is like this. This light, where I'm sitting in this room, is good for Belladonna. So this is not a good light for Belladonna. All lights, this bright light. Oh, no, he can't. He can't take it. So in Belladonna, everything has to be light, very dim light music, very soothing, not like a blah, 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 no. Light topic. Topic has to be light, comedy, not serious, no politics. He just want to know what is the problem in the light way. So light means for Belladonna is to have a knowledge about his problem. He said, doctor, I just want to have a knowledge about my problem. I don't need a detailed information. Just in case you tell me that this shoulder pain is because of frozen shoulder or something is wrong in the shoulder, just tell me whatever you think. I will agree with you. Okay. And now you say, oh, it could be a frozen shoulder, or it could be that you made some wrong exercise, or something you do wrong. Maybe it's because of that. I'm also thinking like this. So it could be, it could be frozen shoulder. It could be that I did something. You are right, doctor. You are right. So Belladonna easily gets satisfied with your answer. For example, if the Belladonna patient says, doctor, in the morning when I got up, I had a little pain in my chest. A little pain in my chest. And it is this little pain is there from the last 2 weeks. But every day, but it wasn't so hard like today. Today, when I got up, the pain was little bit more than previous days. So I got worried. What is this pain? Is it a chest pain, heart pain, muscle pain, gastric pain, or what is this pain? So I just want to know from you, doctor, is it a gastric pain or is it heart pain? Shall I go for ECG? Shall I do X-ray? Or what do you think, doctor? And as a doctor, you say, it could be a gastric pain. I also think it's a gastric. Okay. So the answer is there and matter is finished. So Belladonna may agree for X-ray. He will ask the doctor, doctor, if you think, may I need to go for X-ray? Do you think that I have to take X-ray or some ultrasound or blood test? I will do it. I will do it. So this can relate to light disaster. So Belladonna needs X-ray, blood test. He likes to know about his problem little bit, and he's a very soothing person. He just make a joke. Sometimes he makes a joke with the doctor. Doctor, tell me, doctor, I want that you tell me a very good name about my disease. What do you mean by good name of your disease? If you tell me simple that this is a shoulder pain, it's not so good. Tell me something very nice name of my problem. When I go home, my wife will ask me, what is the problem? So I would like to tell her that I have a problem, intestinal carcinoma of the big name. I like to, very fancy name. Give me something very fancy that when I tell to my friend, they will say, oh, you really have a problem. But doctor, if you tell me it's a shoulder pain, this is not a fun. Tell me something very, something very brilliant name. Now, this is the kind of nature of belladonna. Okay. And sometimes the belladonna patients say, doctor, for example, a belladonna patient now, the last part of light desire, which is very serious. Belladonna patients say, doctor, please tell me what is my problem. Are you sure you want to know your problem? Yes, sir. I have no worry. Tell me. See, doctor, anyway, I have to die. Anyway, one has to die. Maybe I die today, you die tomorrow. Everybody has to die, whoever has come. So what is the problem? But if you tell me, doctor, if you think I have a cancer, you can tell me. I have no problem. So you want to know that you have a cancer? Such a serious problem? Are you serious? You want to know if you have a cancer or brain tumor? So, for example, if a patient of belladonna having headache for last 1 year, and first time he comes to you for medicine, he never went to any doctor for medicine. The first question he asks you, doctor, what do you think is a headache? Is it a brain tumor? I mean, first day he's meeting you, first meeting, and he's telling you it's a brain tumor. And you say, I don't know if it's a brain tumor. We have to have a CT scan. How can I tell you it's a brain tumor? No, if it is a brain tumor, no problem. I can manage it. Yeah, how will you manage a brain tumor? Oh, doctor, I have no worry. I have no worry to die. So, belladonna has no worry, no fear, no anxiety. Belladonna lives in present day, today. That is the characteristic of belladonna. He lives today. Tomorrow, what will happen is not my problem. I live today. Today is, doctor, today I'm alive. Who has seen tomorrow? Nobody knows what happened tomorrow. So I'm always happy what I have. So belladonna, if belladonna has 100 rupees, and if a friend comes to belladonna and asks for money, can you give me, for example, 90 rupees? And now belladonna only has 100 rupees. If he give 90 rupees to his friend, he will left with 10 rupees only. But he will give 90 rupees. Belladonna is like that. If he has a 50 rupees and a friend will come and ask for 50 rupees, or a friend says, I need 70 rupees, he will say, oh, I have 50 rupees. Okay, take it. He will give it. This is what we call the rubric. Here is the rubric for this nature of belladonna. Belladonna is a very kind person. So the rubric is benevolence. Benevolence is something you are doing as a charity. So belladonna person has a habit of giving the money in charity. He will give the people money. Now, for example, belladonna has given the money. Okay. The wife or the family member asks the belladonna that you only have 1,000 rupees in your pocket and you gave all the money to your friend. Now, how will you survive? I will survive. I will see tomorrow what will happen. So he doesn't care about himself. Whatever he has, he will give to the friend very easily. Belladonna very easily share like a child which give his toy to friends very easily. If a child will see that other child is crying for a toy which he is having, he will go and give him. Okay, you play. Okay, take it. So belladonna is like this. He doesn't take things seriously. He always live in present today. Whatever he has today is enough for him. What will happen tomorrow, we will see. This is one of the light to make things light. So belladonna has a rubric benevolence. Benevolence is different from care. Care is something else. Benevolence is something else. And you know that when you are caring for somebody, you are caring. What is care? In care, you are sacrificing your own comfort. Have you heard the word care? If you are caring for other, what is the difference between love and care? Anybody who will tell? Katie, what is the difference between love and care? Mariam, Ahare, Sayyad, Geeta, anybody? What is the difference between care and love?
Maybe we love someone, but we don't care him. But sometimes we care somebody, but we don't love him. Just we care him because of some other things, humanistic ethics and other things.
A plus B minus C is equal to A plus B minus C is equal to C. C is equal to B minus A. What is this? So you have no care and love for anybody. Anybody who has a love and care, who understand what is love. If you understand what is love, have you lived love in your life? If you have loved somebody,
Love
yes.
is not exactly to be careful. Something we love by heart, but when we care somebody, we do something for him by physical activity.
You are nearly somewhere. Okay. You know, love is blind.
Yes.
Number one. You never know why you love somebody. And love is demanding. Oh, you are my child. I loved you so much. You did nothing for me. You know, a boyfriend always has a problem with the girlfriend. Oh, I love you so much. You did not come. You did not do this for me. You never do this for me. A girlfriend tells the boyfriend, oh, what have you done to me in the life? Nothing you have done to me. What is this love? So love is artificial. It is demanding. Okay? Love is demanding. You always demand. Because I loved you, you have to love me. I loved you, you have to give me. I love you, then you have to give me. I'm your mother. I loved you. So now you have to give me money because I love you. So love is artificial. And what is so love demands sacrifice. Love demands sacrifice. That is the answer. Okay. Always whom you love, you want him to sacrifice for you. But in care, you sacrifice for others. Like for example, I care for my child. I never will say that I cared for you. I only do it and forget about it. So care is like you do it and you never remind somebody that you cared for him. You care by heart and it's not artificial. And when you care for somebody, you are like, for example, I have only one bread and I'm hungry. But if I see that other person in my family is more hungry, then I will not eat it. I will care that first he will eat, then I will eat. This is called care. So, for example, if now what is benevolence? Benevolence is just to make himself happy by doing something charity. When you are benevolent, when you are doing something for charity, for poor, for beggar, for example, you give money to beggar, you give money to the people who are poor, you are giving clothes to the poor people. Why you are giving money to the poor people? Why you are giving money to the beggar? What is your benefit in it? Why you are giving your clothes to the beggars? Old clothes. Why not new clothes from H&M? Why not you go to the supermarket and bring very good clothes, expensive clothes from the brand clothes and give to the beggar? Why you give the old? Why don't you give the, your bank, all the bank money to the beggar? Why only 5 rupees? If you are so nice, give him the all bank account, whatever you have. You can give your new car. If you give the new car to the beggar, or you give 5 rupees, you never give the new car. You never give new clothes. But you think, oh, I'm so nice. I give poor people many things. I give food. I give money. I give this. You do nothing. You are trying to make yourself happy. So benevolence is like some kind of making yourself happy because you have money. If you don't have money, you are not benevolent. So a belladonna patient always have a feeling that he has money. He has enough. Oh, doctor, God has given me enough. So what if I give? So, for example, if a patient tells me, doctor, even if I'm sick, I still go to the temple. I still go to the mosque. And, whenever I see some beggar, I have a habit of giving my money to the beggars. But you are sick. You are sick. Why you give? You are sick. You need money for your treatment. You need money for your food. You need money for your caring. Why you give your money to the beggar when you are sick, when you need money? You are poor. Still you give money to the poor. Why? You have to keep the money for yourself as a safety. So when a patient is telling you who is seriously sick, and needs money for the treatment, needs money for the food, needs money to take care of himself, and at this level, he thinks of beggar. He thinks of sharing his half money with the poor people or the sick people. Why he is doing so? What is the need behind it? Because that gives him satisfaction. Oh, doctor, I think the God is with me. The God has given me enough. I think I have enough to manage my life, my treatment. I have this. Now, belladonna is kind, not just why? Belladonna is kind because he is in the rubric delusion, wealth, imagination of. Delusion, wealth, imagination of. Now, you know that whenever somebody during their own sick state, when they need medicine, when they have to spend the money on treatment, when they have to spend the money on the doctor, they know that they have little money, but still they want to share their money with the poor people or the needy people or whoever comes and asks the money. The only thing which comes to their mind that the God has given them enough, and so they can part with their money with other. Now, when a person is giving, when a patient is giving money, sharing his money with other people, though he needs himself, he needs for the family, he needs for the wife, and he is sick, he's not working, still he's giving the money. So the people, family member, they scold him, they tell him, why you are giving money to your friend? You are sick, you need money for your own safety. Then he says that I have today I have enough. I will see what happens tomorrow. Now, this is the nature of belladonna as a patient to share his money, to share his wealth with the people. Now, the wealth is not that he's so rich. The wealth is that even if he has 100 rupees in the pocket, he's wealthy. So if somebody say to the belladonna, you have 5 rupees, I need 3 rupees, he will give happily. Okay, you take it. So it is not that they are happy. It is because they feel that they have wealth and they can give the money, they can share their money with others. So as a physician, when a patient tells me that he has a habit of parting the money with the people around, then I ask, why you do it? So the another rubric, which is, the one of the best rubric of belladonna is frivolous. Now, till now, whatever I told you, there is the one rubric which is going behind is frivolous. Frivolous means not worth of serious notice, characterized by lack of seriousness, unserious. Belladonna patient like to enjoy the life as he believes that a person has one life, so live it without restrictions. So another thing about Belladonna patient, he doesn't like restrictions. His logic for this is that if something bad has to happen, it will happen. It is not under my control to prevent it. A Belladonna patient will like to conceal issues about which he doesn't feel pleasant or nice to talk or share. So they hide, as I gave you the example of putting powder or hiding pimples or acne. So one of the best rubric after the frivolous is hiding. In the consultation, Belladonna open up slowly. That is the one thing. Once they open up, then they don't hide anything. So the first thing about Belladonna is timid. Okay, Belladonna has a timidity nature of timidity. Now, if you understand timidity, I don't know. The timidity is not able to put forward their problem immediately. It's like if you ask a Belladonna patient, do you have any other problem? Yes, doctor, I do have few more problems, but I think for today is enough. You take care of my headache. But if you have any more problem, please tell me. I will give them medicine for everything in homeopathy. In homeopathy, we don't only treat headache, we treat the whole body. So if you have a problem for any other issue in the body, you can share with me. No, I think it's okay. You give me for headache because the rest of the problem are not so serious. It doesn't matter if the problem are serious or not serious. You can tell me. Even if the problems are not serious, still you can tell me. Okay, doctor, if you say this is timidity. Timidity is not able to open up. It's not coward. It's not able to open up or hesitation to tell, demand. Okay, what do you need? For example, you ask the child, what do you need? Oh, you're very good, mummy. Okay, I am good, mummy, but what do you want? I love you, mummy. But what you want? No, nothing. I love you, mummy. Okay, but what do you want? Why you love me suddenly? Can you give me the chocolate from the fridge? I like it. It's small. Now, this is called timidity. So they are not able to open up clearly. But once they open up, they open up. So the problem with Belladonna is not able to open up very quickly. They are very shy. For example, if the Belladonna is traveling with you, and the person who is next to Belladonna is very talkative. He's talking about one thing, another thing. Oh, and he asks Belladonna, from where you are? I'm from India. In India, from where? From Delhi. In Delhi, where you live? I live here. Oh, Delhi is beautiful, isn't it? How long you are living it? Now, this person is talkative. He's asking. And Belladonna is answering only in a brief. Yes, no, yes, no. Slowly, Belladonna start to open up with the person. Oh, from where you are? Now, Belladonna asks the person from where you are. And the person says, oh, I'm from Mumbai. Oh, Delhi is better than. And now you see that Belladonna is talking and the other person is silent. So the Belladonna has a habit in the beginning like a child. When a child is coming into your clinic first time, very first time, okay? The first impression about the child is very nice child. You compliment the mother. When the Belladonna child is coming to your clinic, you will compliment the mother for such a nice behaving child. Belladonna child, then he comes and sit very nice. And you say, hello. You say, oh, very brilliant child, very calm child. He doesn't make any noise. And he sit very nicely, Mummy. And now, after just 2 minutes, he touch your computer. Like this, touch. This is computer. Yes, this is computer. My papa also has it. Okay. And now, after another 2 minutes, 1 minute, even 1 minute. Uncle, what is this? Oh, this is my phone. Oh, my father also has. Okay, okay. Uncle, what is this? Oh, this is my box. What do you keep in it? I have my things in it. And now the mother says, keep quiet. Don't ask questions from the doctor. Keep quiet. But now slowly he gets up from the seat. And then he starts moving here and there, touching the things. And doctor say, oh, now sit properly. Mother say, oh, come on, sit properly. Don't move here and there. He will sit 2 minutes. And now he want to touch your computer. He comes to near you, and touch the button on your computer and say, oh, don't touch it. And now he want to touch the button again, like this. Listen, see. And say, oh, what are you doing? Oh, nothing. But he has a habit. So mother says, if I tell my child not to touch anything, for 1 minute he obey. And then he want to touch. So what he will do? The mother says, don't do it. Oh, no, I was not touching it. I was just looking at it. And that, for example, there is a ice cream in the refrigerator. And there is a Belladonna child. Now he likes ice cream. Everybody likes. Now Belladonna child will go near the fridge many times, walking near the fridge. Okay. He is walking around the fridge. And the mother knows that he wants to have ice cream. So she says, oh, I gave you ice cream. Now sit. You will not get ice cream again. No. I'm just passing by ice cream. I'm just passing by fridge. I don't want ice cream. But mother knows that why he's going around the fridge. And then that when he see mother is not there, he opened the fridge for the ice cream. And unfortunately, the mother comes. He closed the fridge. The mother says, hey, what are you doing? I was looking if the ice cream is safe or not. The elder brother, he was coming to eat the ice cream. I told him, no, you can't eat ice cream. Mommy gives one time off. Now he wants to be a smart child. So mommy, I say to my brother, no, only one time ice cream. No second time. It's not good for health. Now mother is very impressed with this child. Oh my child, very good child. But inside, he want ice cream. And when the mother disappear again, he opened the fridge and the mother arrives. What are you doing? No. I opened the fridge. The ice cream was lying on the plate, outside the plate. So I thought it's a wastage of ice cream. So I just, clean it. To clean it, I took the ice cream. I didn't want to eat ice cream. I didn't want to eat. Ice cream was lying on the floor, so I was cleaning it. Now, this is one of the habit, of children of Belladonna. Also, the big. They want to, they want to enjoy the life, and they want to hide. They are timid. They cannot ask directly about the things. That is the timidity, means not able to directly ask what do you want. So they hesitate in the beginning to tell the doctor about their problem. They are not open up with the doctor very easily. So when a belladonna patient comes to you, he will say, doctor, well, usually I'm okay. But if you are okay, then why you come to me? No, I don't have any serious problem. But why you come to me? And, just from the last few days, I have a little bit cough. Little bit cough. I don't have any problem. Only you have come to me for cough? Yes, only cough. No problem. Are you sure? No. With cough, I have pain also in my throat. But just now you say only cough? No. When the cough is there, when I cough, the pain comes. Okay, so now you have cough and pain. That's all? Finish? Shall I finish? No, when I eat, the pain goes more. So this is the third part. When you eat, you feel the pain in the throat. Yes, and then the cough comes. So you are not able to eat. Yes, I'm not able to eat also. You're right. So he's not telling the symptom directly, but he will say to you one by one. That is the problem in belladonna mind because of calculating inability, and he wants to hide. He doesn't know what to tell first. He doesn't know how to tell the doctor because of the calculating inability. He has no idea. So timidity, you must have understood that timidity is like going back or not able to ask the things directly. Hide desire. So hide is one of the commonest symptoms of belladonna, that they like to hide. Hide means that not able to open up directly. They have a habit of hiding, means that not to show the tear, not to show the problem to the people, not to burden the people, not to take the burden, not to disturb anybody's life. So what do they? They will not tell their problem immediately to the family member. But they will do it, but later on. First thing is not to tell. Now, I'm coming to the hide desire. What is hide? And why you want to hide? The problem is that, as I told you, when you become a patient of belladonna, then belladonna, first thing, doesn't like restriction. He likes to eat whatever he likes. He likes to do whatever he does. He doesn't want to stop anything. He wants to continue the life as he was living, as he's living before becoming sick. For example, he likes ice cream. For example, he likes chocolate. For example, he likes to eat pizza. For example, he likes to walk. He likes to do this. He likes to do that. It is his liking. Okay. Now what happened? He becomes sick. Now he becomes sick. Still he has a desire. As I told you in the slide, desire. Now, whatever belladonna desire, he doesn't want to give up. He doesn't want to give up his desires. He wants to continue with the everything. For example, one thing about belladonna is that they don't like to visit homeopathy. And why they don't want to visit homeopathic doctor? Because a homeopathic doctor tells the patient not to take coffee, not to take, smoke, not to drink, not to eat garlic, not to eat onion, not to do this. And he doesn't like a homeopathic doctor at all. He said, doctor, I have a problem. I wanted to visit a homeopath, but I did not visit a homeopath because I know that when I visit a homeopath, the first thing he will say, no coffee. But doctor, I tell you, I like coffee very much. Now, first thing I want to ask you before I start the treatment, shall I drink coffee or not? Now, you know that he's a belladonna patient. You know already inside. Don't say no. Oh, yes, you can take coffee. Really, I can take coffee? Yes, you can take coffee. Wow, you are a very good doctor. I always think that when I visit a homeopath, the first thing he will say, no coffee. And I have been to 4 doctors before coming to you, 4 doctors, and everybody told me no coffee, no chewing gum, no peppermint. And I say, no, I'm not going to take the medicine. Because doctor, how can somebody live without coffee? Coffee, I like very much. In the morning, the first thing what I need is coffee. Okay, so take it. Really, I can take coffee every day. Every day, yes, you can take it. No problem. Wow, you are very nice. So the first thing is you have given him what he desires. So I don't stop him. You take coffee. Now, what I tell him that it could be that while you take the coffee, the result of the medicine will not be good. So it is up to you. You want to leave the coffee or not for a while. For example, 1 week. So what you can do with Belladonna, you can play with the days. Okay, you can take coffee, but I recommend that don't take coffee for at least only 3 days. Only 3 days. Only 3 days. Oh, that I can do. This is Belladonna. So Belladonna doesn't like complete restrictions, but he likes little bit modification. He can do it. Okay, doctor, what about onion? Can I take onion? Because I like onion very much. With every food, I like onion. You know that I cook food without onion, I don't enjoy the enjoyment. Enjoyment is very good for Belladonna. Now, as in my practice, I never ask a patient about garlic or onion. I never tell anybody like this. Okay, no restriction for my patient. They can enjoy or eat whatever they like. That is the one openness in my clinic. I don't tell anybody to eat or not to eat anything. I leave this to the patient. I mean, when you eat certain things, if you get problem, don't eat it. If you don't get problem, eat it. Simple. So when a patient says, doctor, can I eat onion or garlic with homeopathic medicine? Yes, no problem. Oh, wow. Because I like to eat. You know, so that is the one thing which Belladonna likes a lot, to ask whether he can eat onion, he can do this. This is the most nature of Belladonna, to ask, because he likes it. Now, what happened that when a Belladonna patient becomes sick, why he need to hide? Belladonna need to hide the problem because he doesn't like restrictions on his eating, on his enjoyment. So what happened that, for example, Belladonna knows that whenever he eat burger, whenever he eat chicken, whenever he eats something very heavy, so whenever he eats fried things, his stomach gets upset. He knows this. Okay. So when he comes to the doctor and the doctor says, okay, I'm giving you medicine, but you don't have to eat fried things. You don't have to eat chicken. You don't have to eat burger. So what Belladonna says, I promise. Promise them. I will not touch these things till you tell me. Number one. Okay. So Belladonna says, I promise I will not eat it. You give them medicine and matter is over. But in the evening, there is a party. He goes to a party. There is a burger. There is lots of things to eat, which he likes. And now he say, oh, I promised the doctor I will not eat. But the doctor is not here. He will not know. I eat burger. I will not tell the doctor. And how the doctor will know that I ate the burger or not? So what he does, he starts eating everything which he promised to the doctor he will not eat. He will eat. Now what happened? Next day the problem comes. And now his family member also knows that whenever he eats heavy things, fried things, burger, pizza, or certain things, his stomach gets upset. So what will happen? They will be angry with him. Why you eat again fried things, a burger, when you know your stomach can't tolerate it? And also you promise the doctor you will not eat. You know, I can't stop it. When I see burger, saliva comes in my mouth. Oh, so nice. No, let me eat. And you know, doctor, once I start eating, I don't eat one burger, then I eat 3 burgers. Once I start eating something, I can't stop myself. And now the problem is he has a problem. Now stomach upset. Now how to visit a doctor? Because he has promised the doctor he will not eat. Still he ate. So he has to call the doctor. Doctor, my stomach got upset because your medicine did not work. And you are surprised how that I gave medicine today. Next day, his stomach got upset. How is possible? And now I'm asking Belladonna, tell me truth. What is the truth? You must have eaten something fried at night. Because it's not possible that I give you medicine today and tomorrow your stomach gets upset. Doctor, I just, ate 3 burgers. 3 burgers? You told me you will not eat 1 burger and you ate 3 burgers. Oh, doctor, what to do? I was in the party. Now you listen the story of Belladonna. He said, doctor, I went to the party of my friend. And I promise you, I will not eat burger. I was very promised. I will not eat burger. But when I went to the party, my friend, he forced me. I love my friend very much. He forced me. If you are my friend, you have to eat burger. Otherwise, leave me. So, doctor, now you tell me, shall I eat the burger or leave the friend? So I say, so doctor, I'm innocent. I love my friend very much. Just for him, I eat 1 burger. Then my friend brought another burger. Oh, doctor will not say anything. Eat 2nd burger also. I can't offend my friend. He cooked very nicely, doctor. He took 2 hours to make the burger. How could I refuse? So I ate 2nd burger also. But why you ate the 3rd burger? Doctor, after the 2nd burger, it was so tasty, I could not resist. I ate the 3rd one also. So now the story is coming out. So there is a rubric about Belladonna, which is very nice to use. Unreliable in his promise. Unreliable in his promise. Now, Belladonna is the one who he cannot, whatever promise he makes, he will not stick to it. He will break the promise. Because he feels he's innocent. Now, for example, you tell your patient that next time you have to come after 1 week. Yes, doctor, I will come. I will call you after 1. But after 1 week, make sure 99% Belladonna will not call you. Now, after 2 weeks, he call you. Oh, doctor, I'm sorry, I forgot to call you after 1 week. I told you I will call you after 1 week. I'm sorry. But why you forget about it? Oh, doctor, I was so busy. I thought that, I know that I have to call you. I apologize. Next time, I promise. I call you. You give me the date. Which date I have to call you, doctor? Oh, 20. Okay. I have written, doctor. On 20 at 5 p.m., I have to call you. I have noticed. See, doctor? Next time, I promise. Now, next time never comes. Now, after 3 weeks, he calls you. Oh, doctor, I'm sorry. I really am sorry. The paper, I have written on the paper. But my wife, she's stupid. She thought it's useless date. She took the paper out and threw in the dustbin. It's not my fault. My wife, my son was playing and he spoiled the paper. But nothing happened like that. But he made the story. But next time, promise. So Belladonna always makes the promise, but never fulfill it. It is not that he's cheating you. He's not cheating you. Belladonna is not a cheater. But Belladonna is frivolous. He doesn't take the promise seriously. For example, Belladonna makes a promise with the doctor. Doctor, I promise. Next time, I will not take cold drinks. I will not even see the Coca-Cola. I will not see ice cream. Even if somebody offer me ice cream, I will refuse it. No ice cream. No Coca-Cola. Never. I promise. Okay. I don't know how you promise in Iran. But the people here, they don't promise, but they say like English way, oh, I promise. Okay. So what happened? Belladonna goes outside, just outside, and he's passing from the shopping center. There he sees the ice cream. And now, where is the promise? Just 10 minutes before he promised, I will not eat the ice. I will not eat the ice cream. After 10 minutes, he's in the market. And there he see ice cream shop. Oh. Now he's watching ice cream from the window. And then he said that, I have not started the medicine yet. Let me eat the ice cream first, then I eat the medicine. So if something has to happen, the medicine will take care. So he will not eat the medicine. He will keep the medicine in the pocket and he will eat the ice cream first. And he thinks that first he will eat ice cream and then he will take the medicine. If something has to happen, it will happen before the medicine, and after the medicine, things will be okay. So with this, he can fulfill the promise, and the promise is there because he will not eat the ice cream after the medicine, doctor tell me, but not before the medicine. So this is the funny story about Belladonna. He's so frivolous. He doesn't understand the promise. He has to enjoy the life. Enjoy the life is very important. So what happened? The family member, they are always behind Belladonna. And he's very scared of, the people say, I told you not to eat cold things. It spoil your, throat. Now you are in problem. The mother tell the son, the mother tell the child that I told you many times not to eat cold. I told you many times not to drink cold water, but still you don't listen to me. See, now you are sick. Now, Belladonna doesn't want this kind of advice. He doesn't like it. So what happened then? For example, Belladonna, child, take the cold water without telling the mother or hiding from the mother. He open the fridge, take the bottle. Before the mother comes, he put in the fridge and lock. But after some time, his throat get affected. And now he knows that the mother will understand that he had taken the cold water. Mother will understand immediately that you have taken the cold water and you did not tell me. Now what to do? He has a throat problem. So first thing, what the Belladonna child will do, he will stop speaking. And for example, the mother says, do you want to eat? Do you want to eat or not? I'm not hungry. Because if he eat, his throat will get hurt. So the first thing what he will do, I'm not hungry. Why you are not hungry? You have not eaten anything from the morning. Eat something. No, I'm not hungry. And then he has a cough. The mother says, oh, you are coughing. No, I'm not coughing. Brother is coughing. I'm not coughing. It's just by chance cough come. So whole day he will not tell the mother that he had water and his throat is paining. Whole day goes like this. And he stopped eating. But the mother understands something is wrong. Now the mother is very clever. The mother says, tell me truth. Have you taken the cold water from the fridge without my knowledge? If you tell me truth, I will buy you ice cream. But if you don't tell me, I will not buy you ice cream. Now he's stuck. What to do? To hide or to have ice cream? Now he likes to have ice cream. Actually, mother, you know that I opened the fridge. I checked the bottle. But it was not so cold. I thought that it is a warm bottle you put in the fridge. So I took the bottle and I wanted to check if it is cold or not. I only took 2 sips like this. And I thought it's not cold. I took 2 sips more and then I found it is cold. I immediately put in the fridge. Now, this is the story a child makes with the mother. And mother knows that this is a false story. So a child is afraid of mother because the mother will scold him for doing things which mother doesn't want him to do it. because mother knows he will suffer. So this is the rubric. Why the belladonna hides? Because he doesn't like to be admonished. Admonition aggravation. So there is a rubric called admonition aggravation. So belladonna is the one person who wants to enjoy the life without restriction, without advice. He doesn't like somebody to give him advice, what to do, how to do. For example, if a mother advised the child, you have to come early in the evening. You cannot spend the night in the outside. You have to be at home before 8 p.m. I know, mother. I'm intelligent. I know what to do. I don't like your advice. So belladonna patients, they don't like advices. That is why they don't want to tell their problem to the family member. They keep the problem with themselves. So when a belladonna patient comes to your clinic, he said, doctor, please, when my wife calls you to know about my problem, don't tell her anything. Just say everything is okay. Or just tell her a little bit. But don't tell her, because otherwise when I go home, she will start scolding me. I told you not to eat this. I told you not to do this. I told you not to do this. Still you do this. And then you get sick. Then I'm in trouble. You make the whole family in trouble. We told you many times not to do this. So belladonna has to hide. Because of him, the people are in trouble. They get in trouble. But he doesn't want to leave the enjoyment. So one side there is an enjoyment, and another side the people will scold him. So he has to hide. He has to eat, but he will hide it. So what belladonna people do? For example, in the last I gave you, there are people with diabetic. And you know, in India, I don't know, like Iran, there are small shops, sweet shops, like in Turkey. So for the diabetic people, the family member are very strongly restricting him not to eat sugary thing. Okay, they tell him. Now, he knows he is a diabetic belladonna, but he likes the sweet. So what he will do, he will buy the sweet, eat near the shop, hiding somewhere under the tree. And you know, after coming from the office, but before coming to home, he will buy a small sweet, little bit. He will eat immediately. He will clean and come home. And you know, because he cannot stop it. He knows he's a diabetic. So when you ask a diabetic patient, why you eat sweet? You know that you will die. He said, doctor, I have to die anyway, with diabetic or without diabetic. And also I have been taking medicine and they are not helping me as much. So why to stop sweet? I want to enjoy the sweet. Let me die. So what? If you know that after eating the sweet, if I have to die after 20 days, or if I don't eat the sweet, I will die after 40 days. So what is the difference? I have to die. In 20 days or 40 days, it doesn't matter. But if you think that if I don't eat the sweet, I will live for 40 years, more than when I eat the sweet, then it makes a sense. But if you say that if you eat sweet, you will die in 20 days. But if you don't eat the sweet, you live 40 days. So what is the difference? Let me eat the sweet. So belladonna, the last rubric I'm giving for you today for the belladonna is, when a belladonna type talks like this, there is a rubric called objective reasonable. Objective reasonable. So belladonna always has an objection to the point that what is the difference if he takes, what is the difference between eating and not eating? What is the difference between restriction and not restriction? What is the difference if he takes the medicine and not to take the medicine? What is the difference between the two? If he takes the medicine, what is the benefit? If he doesn't take the medicine, how is benefit? So if there is not too much benefit of taking the medicine, not taking the medicine, then it's better not to take the medicine and enjoy the life. This rubric is called objective reasonable. So there are many people who talk like belladonna that, doctor, you are telling me not to take coffee. Okay, I agree that homeopathic medicine will not work better if I take coffee. Okay, I agree. But tell me, if I don't take coffee, what is the chances that my problem will get better without taking coffee? Now the doctor can't answer this. I mean, if I say the patient, don't take coffee, otherwise medicine will not work. But the patient says, if I don't take coffee, how much it will help me with coffee and without coffee? Now, I have no answer to this. If he takes coffee, what is the harm? If he takes coffee, what is the harm? So the patient say, I don't understand why homeopath says no coffee when they don't know what is the benefit of taking coffee or not coffee. If you are not able to explain me, then don't tell me to take coffee or not to take coffee. Then this is a rubric objective reasonable. So Belladonna is very reasonable. He says, I agree to quit coffee if you explain me why coffee is bad for me. But if you are not able to explain me, then I will take it. So you have to explain the patient why coffee is bad for him, otherwise he will take it. So I hope this rubric is clear to you, objective, reasonable. And the most, I gave you only up to 30% of Belladonna from my 32 years of experience. So 70% of my experience is still there in Belladonna, which I will cover up in coming days. In between, I will tell you more about Belladonna. But till now, what I've told you is practically proved, practically applicable. After my lecture, you just remind yourself, if you have seen such people talking like this, if you agree with me, try to apply Belladonna, see the result, and then you tell me whether you got the result or not. So first you have to follow me blindly. After you follow me blindly, then don't follow blindly. Okay? So with this, I leave you. Enjoy Belladonna. Maybe you are also Belladonna in between you. Maybe you love to eat sweet, even if you have a problem like this or that. So Belladonna is a very good, charming remedy. You could prescribe it for many, many cases. It doesn't matter acute or chronic. Just listen the patient carefully, how he speaks, what he says, exactly in my words. You get my videos, listen them again and again and again and again. Okay, bye-bye. Thank you very much for this session. And this is the 6th session is over. Anybody who wants to say good thing like Belladonna for me, you can say. Anybody? Katie, you want to say something like Belladonna, promising something? Oh, I promise I will apply Sehgal method. But after finishing, oh, I don't understand anything. So, Katie, Bahrain, everybody is happy? Bahrain?
Yes, it was very good. Thank you.
Okay. Okay. Mariam, what have you learned?
I learned very much from Belladonna because I was watching Belladonna as an acute more. But I know that the Belladonna character is very, very much between us.
Okay, good. So over to Vedant to finish today's session.
Yeah, hello everyone once again. So it was a very beautiful journey we just had of Belladonna. It was not complete. As you know, our medicine is never complete. It's many rubrics yet to come. So, but we learned a side of Belladonna. And before ending today's session, I would just like to tell you a difference between a Stramonium child and a Belladonna child when they come to your clinic. How you can tell them that is a Belladonna child or a Stramonium child. When a Belladonna child comes with their parents, they will be shy when they enter the clinic. They will not talk to you, will be very shyly, will sit silently. But once when you start talking to them or when they open up, they will become like, you know, they don't know what shyness means. They will roam around the clinic, disturb your things and become very playful with you. But Stramonium child is exactly opposite. They will come boldly in your clinic and ahead of their parents. They will enter you boldly in their chamber. But as soon as you start talking to them or tell something about like I will give you injection or something, or you tell them the parents to go outside for a bit, they will suddenly become shy. They will get started scared. So the boldness is just show off type thing. So this can help you in a little bit in differentiating between stramonium and belladonna child. So thank you all, and we'll see you again in the next session. Have a good day.